very easy to turn the minds of a hostile nation because they're being primed with other problems, and because Michael's legacy is still out there very, very tainted, and, I can see it sort of happening again. And I heard that, a second pathology was done on his body, and they're trying to say that he had alpha-1 antitrypsin deficiency syndrome, which is, what they were alluding to, that he was going to die from 6 months before he did, and that they had some evidence of pulmonary hemorrhages on his lungs, and they were going to try and throw this up, that, as a defense also, that he may have died from natural causes. So here we have it, that he sort of contributed, sort of to his own IVs, that he may have died from natural causes. And it seems to me that they're both the exclusion clauses of who is to pay out, sort of for the tickets. For instance, the tickets are 85 million for London, and, that money is just returned. The merchandising is 25 million. So, that's a lot of money. That's 120 million that somebody somewhere has to make a decision as to who's culpably responsible, so, yeah.
Right, and I hadn't heard about the second pathology, but I did hear about the original where they were trying to say that he had injected himself, which is ridiculous. And it's scary that how they're going to try to turn it around and make him seem responsible for his own death.
Yeah, I know.
Yeah. They are, as I understand it, getting fluids from his body.
Yeah, the fluids are still off in specimen containers, and they have allowed access to them. I think probably what they're going to do there is to say that, sort of the level of propofol in the system possibly wasn't enough to kill him. And so I suppose they would be allowed that as a defense from the point of view that they would be given independent laboratories to test the levels, because certainly if the level came back that it was, because the basis of the, I suppose, prosecution is acute propofol intoxication. So as a consequence of that, it would have to be above normal therapeutic levels to cause respiratory arrest, which probably happened rather than cardiac arrest. And so they would be entitled to independently, I would think, check that. So if it came back, for instance, there was a difference between two laboratories, the case could easily fall apart on something like that, so...
Well, I know that they need to check the other drugs that were given to him in it also.
The interesting thing is, sort of when Michael was with us in Ireland, without going into any of his medical conditions or anything as well, and, I would never do that, but he also received propofol from us. But, the thing is that he would never do it in the absence of anesthesis, and, and I have... good evidence of that, let's put it that way, if required. So, for somebody who, sort of would not, take, not even propofol, but midazolam or any, sort of the other sort of benzodiazepine types without anesthesia being present, it beggars belief that within a 2-year period that suddenly he would be, sort of a self-injecting drug addict. It just doesn't add up.
I wish Mesero was the person there that was doing this case. I really do.
Yeah.
And not Mr. Oxman.
Brian Oxman's covering it for Joe, Michael's father. But Catherine has a different defense. There's going to be 2011 with cases. I think that the Conrad Murray case will probably be more like a stalking horse from the point of view that they will be testing the waters in terms of, this is from the family's point of view, what way the sort of, the axe will fall. And then I'd say, a bit like the O.J. Simpson case, the family will take a private, sort of bill, and the fact that Catherine is coming in behind it now would mean that will give it, sort of a lot of credibility. And I think it will be in that period that any possibility of restoring Michael's good name, his dignity, and leaving a good legacy behind, I think will happen in that era, I think during the first LAPD case, this will be when all the mud will be thrown, and I think we should prepare ourselves for that,
Yeah. And I'm sorry, Catherine, were you going to ask a question?
No, I just had to moan listening.
Oh, okay. One of the questions I had, Patrick, was on the propofol. From the autopsy report that I had read, at least, there was and I forget who it was, someone had come out. I think it was someone who had experience with this. I don't remember the title of the person, but they had said that the amount given to him was the amount that you would give in intra-abdominal surgery and would require resuscitative equipment and a breathing tube and all that.
Well, I suppose there's a couple of things there. The first thing is the figures that Dr. Murray has put out that he gave him, sort of, I think it was 2.5 milligrams, would be so, sort of small regarding, sort of some of the sedative type medication that probably wouldn't be enough to induce or reduce insomnia very much. So I would think that we could probably only go by the serum levels of propofol, and I think there's some brain tissue as well that has been taken for sort of chemical analysis, because, anybody can say what, I suppose, they get in PO or IV, but, the labs won't lie in terms of the serum levels, and I would think that those levels, Deborah, must be high enough for LABD to put that down as the main form of homicide, that it was intoxication due to propofol. So I would think that probably they would pretty firm evidence that the levels would be high enough to induce, sort of a respiratory arrest.
Now, even if it were not, just the idea that he knew the person can't, with propofol, diprofan does not allow you to breathe.
Yes.
It just shuts everything down.
Right.
So he should have been there helping Michael breathe.
Yes.
But he was out on the telephone.
Yes. It does all sound, sort of incredulous.
It does. And I thought to myself, I really have wondered, as Catherine, says AEG had something to do with that. I really wonder if his girlfriend was connected to AEG or something like that.
Yeah, so I suppose there's no doubt about it. Conspiracy theories probably will abound for a long time, and
it will, I'm sure.
Yeah, and it is a good fit from the point of view that, sort of a lot of people certainly made money out of Michael's death. But I suppose and will do for the next 10 years. But I suppose the court case hopefully will bring some sense of objectivity to it. But I'm not sure if we'll ever
does that. No doctor would do such a thing. It has to be on purpose. I cannot think of any doctor that no doctor would ever do such a thing.
Sure.
Would just leave you with a drug running into your vein and go off and have a cigarette and sit on.
I have to be very careful, of course, what I say, because if I'm called as a witness, I would have to maintain some sense of objectivity and credibility, and certainly I would think that your expressed opinion there would be the correct one. It would seem unusual that sort of somebody in that situation would. It's just that I know that I've been in that situation myself with Michael, and he refused it, and that's quite important. And I have some other sort of evidence of that's probably maybe potentially very vital. But I mean, there'd be a time and place for everything, and I think that it's going to be, sort of an interesting period. There's no doubt about that.
And do you mean he refused to have propofol or without an anesthesiologist, or is that what you meant? I'm sorry, I was just trying to understand.
Yeah. No, let's say I have some graphic evidence as well.
Oh, okay.
Yeah.
Yeah. And is it true? It's true also that I don't know if I'm saying this right. The benzodiazepines that he was given, those also, in conjunction with propofol, can cause the respiratory and cardiac arrest, right?
Oh, there's no doubt about that. Yeah, an accumulation of sort of sort of the benzos are all respiratory antagonists, and as a consequence, the mixture. You could have a synergy in existence. There's no doubt about it that 2 and 2 might come to 5 rather than 4 with, sort of particularly, I mean, midazolam and the propofol wouldn't be necessarily a good mix. But also people can, build tolerances to these, and unless Michael changes into a totally different person than I knew, it does seem to be, to me, to beg a belief that suddenly, sort of he would be dealing with this level of, medication. let's put it this way, and I certainly wouldn't be breaking any medical confidentialities. In the 6 or 7 months that sort of Michael was with us, I certainly may have written him 1 or 2 prescriptions, but none of them were ever for any drug, and none of them were ever for any medication that would be given for insomnia. So I'm not saying anything but in the negative, if you know what I mean. So I'm not breaking any confidentialities, because I can certainly say with, sort of a hand on my heart that, in all that period, any script I ever had written him was for very benign things, more for a cold than for sort of anything else, if you know what I mean.
Wow.
But
that's so important. It's just a shame people can't, because there's so many lies out there about even that now.
Oh, it's incredible. And I mean, he had total access, sort of almost, to get what he wanted. So unless he had a suitcase of medicines coming from somewhere else, I never seen anything in his house. I never wrote anything for him, and certainly any time, sort of I ever seen him, he sort of, he was in his full mentality, and certainly was never sluggish or anything, just, sort of warm, loving, and fun, He had a great sense of humor, And
that's what I heard, he was very funny.
Yeah, and he'd creep up with these things on the back of you that sort of, that you wouldn't expect, both in sort of practical jokes and in terms of one-liners,
Okay.
And he could get into the culture of a country as well, and he was very intelligent. This is the thing that sort of didn't seem to come across as well, through a lot of people. And a good guitarist, pianist, and he had, I suppose, different intake or input into, he could sit and tell you about Ireland in a way that sort of I wouldn't have expected. He'd know about, sort of history, sort of surrounding the place he lived, back maybe 2,000 years.
Wow.
That type of thing in a way that even though I lived in Ireland, for instance, sort of outside Grouse Manor would have been the area where the High Kings of Ireland would have been crowned right up, I think, to the 7th or 8th century. Well, I never knew that. He knew all that,
And I had heard that he was a very avid reader, that he read up on so many different subjects, and so he was very into history then, too.
He's very into medicine as well, and there's no doubt about it, sort of, I have a nice library in the clinic, and, sort of, he often wanted to deprive me of some of my better texts, and any of the things he'd pick out would be about $400 books, and I'd try and replace them with something. I said, Michael, there's nicer pictures in this one or something. And he'd look at me and say, I don't fall for that sort of thing, Patrick, But it's funny, the sort of things he'd be looking at would be, unusual, it'd be like operations and, sort of things like that, and, but,
wow.
yeah, I mean, he was an avid reader, and the sort of things which interested him were a bit unusual, I would have thought, because you wouldn't have a situation where, sort of the average patient would come in and be looking at, sort of facial anatomy or surgery and know anything about it, and he would know a little thing, you'd be discussing something like, an artery or a blood vessel, tell me the sort of dangerous, places in the face. And I said, well, the mandibular thing runs there, and, the facial nerve runs along here from the alar tragal line. Alar tragal, where is that now? That's the tragus on the ear, is it? Yes. So it'll be almost like, or you'd be, sort of looking at a book with something, and there'd be, I don't know, like an albatross or something, and he'd know the, the genus and the species,
Wow.
That's, it was amazing, sort of that, because it's not the sort of level of knowledge you'd expect a pop star to have,
Right,
from the
exactly.